Hi, my name is Dr. Alexander Alemis, and this short video is to show you our technique on brushing and flossing. I see a lot of people doing it many different ways, and I like to show you our technique and why we do what we do when we brush and floss. Before I show you, I'd like to explain that if I could teach people how to brush and floss and get them to do it regularly, it is more important than anything else that a dentist can do. When you're brushing and flossing, you're taking care of all your teeth. When you're having a root canal or a crown, you're only taking care of one tooth and only one problem with the tooth. Brushing and flossing is the best and most important thing you can do for your teeth. There are many techniques that are trying to help people having a difficulty with manual dexterity or who just don't want to do it. But the most important thing is to use a toothbrush and a floss. I know there are many water picks you can use different electric toothbrushes, but the regular toothbrush and a floss cannot be replaced for proper oral care. So what is our family dental care technique on how to brush and floss? Well, before I explain the technique, let me show you that what you're after brushing is not your gums, because your tongue does this. So your tongue brushes all your gums, and it brushes the surfaces of your teeth. What you're really after is the interface between the gum and the tooth. This is what you're after, to brush this area and clean this area. This is the area you're after. Not here, and not here, and certainly not here. See how smooth that is? This stuff is not gonna, you don't need much work there. This is where the problem begins. This is where the gum disease begins. So, and the gum disease is nothing other than stuff getting under the gums here. There's a little trough here, about 2 to 3 millimeters, which is normal. Your gums attached to your tooth about 2 millimeters or 3 millimeters below what you see here. And that is normal, and you can get rid of it with a brush. But if there's stuff that goes below that and it causes the gum to break down farther, then what you end up with is what we call gum disease. You have bone loss. The bone does not like inflammation and doesn't like stuff that's there that's gotten hardened and becomes what we call calculus, which is as hard as stone, and we can see it on the x-rays. So how do you brush and floss? If you're going after the interface between the gums and the teeth, you brush at a 45-degree angle, back and forth like this. Same thing over here, same thing inside. 45-degree angle, like this is 90-degree against your teeth and the gums. This is parallel to the teeth and the gums. Okay? You want to do halfway, like half of the bristles on the gums, half of the bristles on the tooth, and you go back and forth like this. And that's the way you're going to brush all your teeth all around. You switch it here from the inside this. Keep in mind the back of the tooth, you go in the same thing. You're after that interface to get rid of whatever is in there, all the bacteria, calculus over the years. Well, hopefully not over the years, but over the last few days. So, and then you can brush right on top here after you're done with that. Just like this. Up here, same thing from the inside. You half the bristles on the tooth, half on the gum. Half the bristles on the tooth, half on the gum. Half the bristles on the tooth, half on the gum. The last tooth, you got in there, hit it like that. Half of the bristles on the tooth, half on the gum. Back and forth. It's a back and forth motion. This up and down doesn't do anything. It's a back and forth motion, and you just go on top of this surfaces here like this. Okay? Now, in terms of flossing, you go in between the teeth. You wrap the floss like this on both sides, and then you go in. You don't snap it in. That can damage your gums, like if you snap it in. So what you do is you go in. You go back and forth, and you let it figure one that's easier to do. They're not connected, but so you go in and you wrap it around one tooth. You go down under the gums. You wrap it around one tooth and back and forth out. You go back again the same spot. You wrap it around the other tooth, back and forth. You wrap it back and forth and out. That's how you would floss. So you would go through the opening twice. One we can let us. This is just a model, but your teeth will be able to slide through here very easily in the mouth, and some are tighter than others. So you go through back and forth out, go down through back and forth out. So that's how you would floss, and you would do all your teeth, the front, the back, all of them. You just drop in, wrap it around the back tooth, out. Then you go in again, you drop it and go wrap it around the other tooth and out. So research has proven that if you floss once a day and brush twice a day, you're good to go. When you get bleeding, that means there's inflammation. That means you have missed areas and there's stuff that is just not quite clean. The more you bleed, the more you should brush. The more you brush, the less you bleed. If that doesn't go like that, you should see a dentist. And that is the essence of our technique of brushing and flossing the teeth. And if you wait too long and you don't do this often enough, you're going to end up with gum disease. Then you have to come to see the dentist, where they have to get under the gums in order to clean the teeth, which is called deep scaling and replanting. And that's part of a periodontal treatment, and that has to be under anesthesia, which is obviously makes it a more involved procedure, and it, as such, costs more money. So that concludes the brushing and flossing of. See, they're all clean now. Thank you.